Good morning, everyone, and welcome to the presentation on substance abuse and the effects on the oral cavity. My name is Kayla Mosley. I am a registered dental hygienist and I work for the American Dental Hygienists Association. I have worked in clinical dental hygiene for 10 years prior to moving into education with the ADHA, which I now have 5 years of experience with. During this class period, we will discuss the effects of substance abuse and the oral cavity. We will talk about the foundations for the healthy oral environment, how homeostasis changes with the introduction of substances, how to monitor for substance use, and how to prevent it as a healthcare provider. The goal of this course for you, the audience, is to gain knowledge on how to properly identify and prevent substance use in the healthcare setting. We'll also go over the importance of seeking professional help and intervention before these issues become more severe. So before we jump into the presentation today, I would like to have everyone participate in an introduction and an icebreaker or a warm-up. So when we think about oral health, we think about it being on a spectrum. On one end, we have perfect health with healthy gums and teeth. On the other, we have serious problems like tooth loss and gum disease. So I want you to think about things like tobacco, alcohol, and drugs. When do you think that these substances start to affect oral health, and when do they cause serious damage? So take a moment, write down your thoughts. Would anyone like to share where they place substances like tobacco, alcohol, or illicit drugs? So go ahead, take your time, and then we'll all come together and discuss that. So thank you for your participation in that warm-up. Today we'll explore how substances can speed up the movement down the oral health spectrum and discuss ways to monitor and prevent substance use in the healthcare setting. The objectives for today are, by the end of the lesson, 85% of participants will be able to identify 3 specific oral health issues caused by substance abuse. By the end of the lesson, 70% of participants will be able to provide at least 2 examples of how substance abuse exacerbates oral caries. So what is a healthy oral cavity? When we talk about a healthy mouth, it's important to understand that oral health extends beyond just the teeth. A truly healthy mouth includes not only the teeth, but also the gingival tissue, the gums, the supporting bone structure, which together make up what we call the periodontium. This all holds our teeth in place. The gingiva is essential in providing protection and support for the teeth as it forms a barrier between the teeth and the rest of the body. Healthy gums are important to maintain oral health, and any sign of inflammation or infection in this area can lead to serious oral, even systemic health issues. So healthy gingiva can vary depending on a person and their pigmentation, but healthy gums are typically firm and coral pink. They may be more pigmented in certain people. When the gums are healthy, they do not appear red, swollen, or tender. They should not bleed when brushed or flossed, and gums that are swollen or bleed easily are often signs of gingivitis or an early stage of gum disease. A healthy mouth should be free from tooth decay. There should be no lumps, sores, or unusual discoloration in the mouth. The tongue, cheeks, and gums should have a consistent appearance with no signs of infection or disease. Teeth should be firmly secure, meaning that they shouldn't wiggle or feel loose in the mouth at all. Chewing and brushing should not cause discomfort, and any pain while eating or brushing can indicate some type of underlying issue like cavities, gum disease, or other oral health problems. So again, this is an unhealthy mouth. This mouth specifically is a picture of generalized cervical caries in a 33-year-old heroin user. When we say cervical caries, cervical is the portion of the tooth that meets the gum tissue. So you can see all of this, the discolored portion of the teeth are right along the gum line where plaque would build. And in this individual, it has progressed to a severe case of decay or caries, otherwise known as cavities. An unhealthy mouth can be full of fractured teeth. This can be caused by the teeth breaking or cracking due to trauma, biting on hard objects, or decay that weakens the tooth structure. A fractured tooth can be painful, especially when chewing or exposed to hot or cold foods. And it can also lead to infection if the fracture exposes the tooth pulp. So when I say pulp, I'm talking about the most inner layer of the tooth. We have several different layers of the teeth. The outside portion that you can see when you look inside of your mouth is called the enamel. The layer just below that is called the dentin. It's very soft. And then there's a portion that covers the root surface underneath the gum line that's called cementum. And inside the very, very middle of that tooth is what we call the pulp chamber, which houses the pulp. And that is the nerve and blood supply of the tooth. When that area of the tooth is exposed, the nerve is exposed, and that is when it becomes painful to a person. So moving on to halitosis, which is the scientific term for bad breath. This is another concern that can be linked to a variety of factors, including poor oral hygiene, gum disease, dry mouth, or even systemic health issues like a GI disorder. It can be chronic bad breath can be an indicator of an underlying problem like gingivitis or periodontal disease, which is advanced gingivitis. A dental abscess is a localized collection of pus or an infection that causes severe pain, swelling, and a potential systemic infection if that localized infection begins to spread to other parts of the body. Oral cancer is a serious and life-threatening condition that can show up as a lump, a sore, or an unusual color in the mouth, the lips, or the tongue. The most common site of oral cancer that dental professionals find in a patient's mouth are on the back of the tongue, on the side of the tongue. So right where your tongue meets your teeth, in the very back of your mouth, is very hard to see, which is why it's often not caught until you go to the dentist and they perform an oral cancer exam on you. That's the most common spot that we typically find it in the mouth. These are all the parts of the oral cavity that are typically affected by substances. We have the gingival, mucosal, and buccal tissue. Gingival tissue are the areas where your teeth meet your gums. This is what we call the gums. The mucosal layer is the area in between the gingival tissue and the gum tissue, or gingival tissue and the cheek tissue. And cheek tissue is called buccal tissue. These are all the scientific health terms that we're learning about today. The periodontal ligament are tiny little fibers that run from the root surface of the tooth up into the gum tissue and connects the tooth to the gum tissue. The maxillary hard and soft palate, maxillary meaning maxilla, which is the upper jaw. This is the hard palate here in between the teeth. When you press your thumb into the roof of it, it feels hard. The soft palate is here in the back of the throat where the uvula hangs from, that little punch-in bag back there. We have the tongue, the salivary glands. There's only two that we are going to talk specifically about tonight or today. The parotid salivary gland is here in the cheek. It's right next to these upper molars in the back of your mouth. And then the sublingual is just here below the tongue in the floor of the mouth. We have the nasopharynx, which runs from, it's in the back of your throat, runs from your nasal passages down into your throat. This is your pharynx here. And then of course, we already talked about the teeth and the different layers of the teeth, the enamel, dentin, cementum, and pulp. So what is substance use disorder? Substance use disorder is a very complex and chronic condition that affects the brain and the behavior of the person using. It leads to a compulsive use of substances despite all of the negative consequences that come from it. It's characterized by a persistent and intense desire to use a particular substance. It leads to a loss of control and an inability to stop even when the user knows that it's causing them harm. It is a medical condition, and its diagnosis is based on several different things, including impaired control over the substance use, social impairment, risky behavior, and the presence of symptoms such as tolerance and withdrawal. This means that someone that has substance use disorder may experience a physical change, like needing more of the substance to achieve the same effect, which is what we call tolerance, or experiencing the withdrawal symptoms when they stop using it. It's very important to note that a key aspect of substance use disorder is that it involves a cycle of relapse. So that means that individuals may go through a period of recovery, but often they return to use that substance at a later time. And it's part of just the chronic nature of substance use disorder is that it's a very difficult condition to manage. Types of substances that are typically abused. These are the most common ones that we find in healthcare with our patients. There are many different ones, but the most common ones include alcohol, cannabinoids, opioids, cocaine, sedative hypnotics, hallucinogens, tobacco, and a few other substances. I did add on this slide the kind of street terms or the slang for what they're commonly called by users. Cannabinoids being marijuana, weed. Opioids can sometimes be known as like oxy. Cocaine is known as blow, powder, snow, or coke, and hallucinogens are often called acid or mushrooms, shrooms, and are taken because of the vivid trips that they provide for the user. Let me go back to this slide. When we talk about like the most commonly used substances that we find in healthcare, the cannabinoids or marijuana or weed is probably one of the most widely used recreational substances. It is legal in some areas, but abuse of this substance can still lead to negative health outcomes. It includes issues with memory, concentration, and lung health due to the smoke. It can cause dry mouth, gum disease, and oral health concerns. Opioids include prescription painkillers like oxycodone, hydrocodone, morphine, are abused for the powerful euphoric and sedative effect. A lot of people use these by taking them orally and swallowing them, or crushing them and snorting them to intensify that high. Opioids are extremely dangerous because of the nature of overdose and addiction that these drugs can cause. It can also lead to very severe oral health issues like dry mouth, gum disease, tooth decay. It's sometimes interchangeable with the term meth mouth, if anyone has heard of that. Not because it is methamphetamine, but because it's very similar to the oral effects of that drug itself. Cocaine is a potent stimulant. It's often called blow, coke, or snow. It can be ingested through various methods like being smoked, snorted, rubbed into the oral tissues, or injected. It induces an intense euphoria and energy, but also comes with serious health risk. It constricts blood vessels in people, which can lead to reduced blood flow to the gum tissue and to the teeth. It very commonly causes gum recession, tooth decay, and sometimes tooth loss. Hallucinogens are substances like LSD or acid, mushrooms. Again, they're taken for the trips that they induce. They're not physically addictive as other substances are, but they have serious mental health consequences, and their misuse can increase the risk of accidents or dangerous behaviors while using that drug. So how do substances affect the oral cavity? The most common one that we see with any type of substance, even a prescription medication, the most common side effect on the label of all drugs is dry mouth. Dry mouth is also known as xerostomia. That's what we call it in dentistry. So the saliva in our mouth plays a very critical role in maintaining oral health because it neutralizes the acids in our mouth. So the bacteria that live in our mouth when we eat sugary foods, the bacteria itself eats that sugar, it converts it into acid, and then the acid is what actually causes decay in the mouth. It's not the plaque itself, it's just the acid is a byproduct of having that plaque sitting on the teeth. And saliva is meant to kind of neutralize that acidic environment. It's also meant to wash the plaque away and wash the plaque off of the teeth. It can also provide disease-fighting substances in the mouth, like antibodies and other different types of hormones that the body naturally creates to fight disease. A lack of saliva in the mouth can cause cavities and can also decrease the oxygen in the gum tissue. Substance abuse, especially tobacco, alcohol, and drugs like opioids or cocaine, can increase the risk of oral infections. Tobacco products like cigarettes or smokeless tobacco can lead to gum disease and a higher likelihood of developing infections in the gum tissue and oral tissue. Cocaine use can damage the nasal and oral mucosa, which can lead to ulcers or sores that can become infected. Oral cancer is a severe risk associated with many substances, but particularly tobacco and alcohol. The combination of smoking and drinking alcohol greatly increases the likelihood of developing cancer in the mouth, throat, and oral structures. It can appear as a small lesion or a sore that's often not noticed until the condition has progressed to a more advanced stage, which is typically whenever it's caught in dentistry, unfortunately. So early detection is very important. You can even perform oral exams on yourself in the mirror. And then periodontal disease and tooth loss. We already kind of talked about that a little bit, but when the gums become inflamed, they bleed, and they recede down, it can lead to tooth loss. And this image here is oral leukoplakia. This white patch here that we see here on the side of the tongue, exactly like we discussed earlier, can also appear on the sides of the cheeks. This is not cancer itself, but it is a kind of a precancerous lesion. So when we see spots like this in the mouth, we begin to heavily monitor this patient. We may even have them go to an oral surgeon and get a biopsy performed just to make sure that this is not cancerous. So cannabinoids. We talked about these earlier. This is otherwise known as marijuana. The main active ingredient in marijuana is THC. This can act as an appetite stimulant, which then can cause people to want to eat more sugary foods that are not good for our teeth. They feel good to us when we're eating them, but the effects of eating these high sugar diets is not good for our teeth. It can lead the user to crave and consume these foods that we call cariogenic, meaning that they cause cavities. They contribute to the growth of harmful bacteria in the mouth that produce acids, like we discussed before, which then leads to tooth decay. People who smoke marijuana or use marijuana, also another side effect of that is sometimes not always taking care of ourselves. A lot of these patients do not brush or floss regularly, do not go and see the dentist regularly. So in combination with these sugary diets, as well as the lack of saliva or a dry mouth, it can create a really bad environment that can cause cavities. So opioids are a class of drugs that are typically prescribed to manage pain, especially after surgery or injury. These drugs are frequently abused because of the sedative effect that they provide and that they are meant to provide. Opioids such as oxycodone, hydrocodone, morphine, and fentanyl have a high potential for misuse, and they can really affect both oral and overall health. Now, I will say that oxycodone and hydrocodone are one of the two most common pain prescription drugs that are prescribed in the dental setting as well. When you go in for oral surgery, like to have your wisdom teeth removed, typically you're sent home with several pills, and it's usually oxycodone. So we have to be careful as providers when prescribing these drugs to patients. Does the benefit of this drug outweigh the risk of sending someone home with this medication, or can they maybe just get by with using something like Tylenol? And there was a study that was performed in 2011 to 2016 by the National Institute of Health, where opioid use was associated with a higher number of missing teeth. 26.3% of long-term opioid users were missing 20 or more teeth. We have 32 teeth in the mouth, so 20 or more teeth is over half of the teeth in our mouth that these people were missing. So cocaine. Cocaine has some of the most severe consequences in a user. The most severe consequence that we see with cocaine is perforation of the hard and soft palate. If you look at this photo, this image above on this slide, this patient here has what we call a oronasal fistula. A fistula is a hole. Oro meaning mouth and nasal meaning nasal cavity. So there is a hole going straight through this patient's mouth right up into their nasal cavity, and this happens when people snort or use cocaine. It is caused because of the corrosive nature of cocaine and the direct damage that it causes to the oral tissues. It soaks into the mucous membranes, it's very acidic there, and it just destroys that tissue as it moves through. There was also a scientific article published in 2021 where several oral alterations caused by cocaine abuse were found, which was primarily perforation of the palate, predisposition to periodontal disease, temporomandibular disorders, which is the jaw joint right in front of the ear that opens and closes your mouth, bruxism, also known as grinding and clenching, someone kind of grinding their teeth back and forth, damage to oral tissues, dental caries, and destructive lesions of the facial midline. So how does tobacco affect the mouth? So smoking exposes the tissues in the mouth to carcinogenic substances or substances that can cause cancer. This leads to cellular change in the tissue that leads to the formation of malignant tumors. Smokeless tobacco is not as safe as you may believe. Products such as chewing tobacco are also linked to oral cancer, particularly in the gums, the cheeks, and under the tongue, as we discussed before. And these cancers, again, are often diagnosed at later stages when the treatment is less effective. So early detection is very, very important. According to the CDC, approximately 43% of adults age 65 or older who smoke cigarettes have lost all of their teeth. And it just really highlights the importance of early detection of any cancer that could occur because of smoking, but also it highlights the long-term effects on smoking on oral health. It accelerates the progression of periodontal disease, gum disease, which leads to the destruction of the supporting structures of the teeth, which then causes the teeth to become mobile and fall out or need to be extracted by the dentist. And then the CDC also reports that over 40% of adults aged 20 to 64 who currently smoke cigarettes have cavities, compared to only 20% of adults who have never smoked. Signs of alcohol use in a patient in the healthcare environment include physical signs that may or may not be noticeable. So something that can be noticeable is flushed skin. It can be accompanied by broken capillaries, which are tiny little, like, microscopic veins in the area of the face. So usually here around the nose, around the mouth and the lips, and it's caused by alcohol. It causes the blood vessels to expand and sometimes burst, which causes the broken capillaries. Physical symptoms like trembling hands can be noticed, a change in the voice, becoming more husky or kind of robot-like. Patients can experience GI issues like chronic diarrhea and vomiting blood. This is a sign of intense GI bleeding and severe liver damage. Signs of injectable drug use. When individuals use an injection or an injectable drug, one of the most visible signs is the presence of track marks. So these patients will have tiny, scar-like track marks on their arms, sometimes in the crease of their arms. Sometimes patients will try to hide these track marks, and so they will actually inject into in between their fingers or in between their toes to make it less noticeable. But the repeated injections over time just cause scar tissue to form in these areas, and that is what's known as a track mark. This is very dangerous. It can cause bacterial skin infections, cellulitis, sores, and another symptom that someone using an injectable drug might have is called trichotillomania. This is known as hair pulling, where they will actually pull their hair out as a way to cope with the physical or the psychological effects of the addiction to this drug. Signs of inhalants and snorting drugs. Someone who is snorting drugs may have regular episodes of nosebleeds, which occurs because of the drying and irritation of the nasal passages from this drug. They may have persistent nasal congestion or a runny nose, unusual nasal discharge, which may have a kind of peculiar color due to the breakdown of the tissue or caused by an infection. They may have a constant kind of sniff or the sound of snorting, and it may become habitual to these patients. Signs of opioid use. Sedative drugs like opioids or benzodiazepines can lead to several cognitive and physical impairments. Individuals who regularly use these substances may experience overall sedation. It can lead to kind of a sense of drowsiness, sluggishness. Memory issues are common in these patients, an inability to concentrate, slowed reaction time. They can have mood swings sometimes. They may feel easily irritable, anxious, or depressed. And then according to the American Addiction Centers, these cognitive and emotional effects are often worsened during withdrawal. So when these patients are going through a period of withdrawal from these drugs, they may experience flu-like symptoms. They can have body chills, sweating, aches, heightened anxiety, which can make it very, very challenging for these people to stop using the drug because of the symptoms that they experience when they do try to quit using. Hallucinogens are drugs like PCP, mushrooms that we discussed earlier. They can cause dramatic changes in people's perceptions and behavior. They may experience synesthesia, which is a phenomenon where they claim to hear colors or see sounds. So they may experience tremors, physical agitation. One very important symptom that these patients experience is an inability to feel pain, which poses a significant risk for injury, but also is something we have to think about in dentistry. If these people are experiencing something going on with their mouth, they may not realize it because they may not be able to feel what's happening in their mouth. So treatment of these conditions that we discussed before that occur in the mouth. Treatment of dental caries is really, it's in collaboration with the dental office and the patient themselves. We see these patients every few months to treat them, but it really is a lot of the responsibility is put back on these patients when they're at home to care for themselves. Like we discussed before, a cavity is caused by demineralization of the tooth enamel due to the acids produced by bacteria in the mouth. So the way that we fix this is for patients at home to be on fluoridated products. Fluoride remineralizes these areas and prevents cavities from worsening or from beginning in the first place. So fluoridated products like toothpaste and rinses at home, fluoride varnishes applied by us at the office, fluoride containing toothpaste and mouth rinses again at home, but also can be used in the dental chair as well. And then treatments of larger cavities that cannot be corrected at home include restorative treatments like composite fillings and crowns. These help restore function and appearance of the affected tooth. It just removes all of the decay and places the filling either into the tooth itself to build back the structure, or if there's not enough structure left for a filling, we'll place a crown. Periodontal disease is treated through a dental cleaning and regular dental visits to help maintain this condition. So if someone is diagnosed with periodontal disease, there is never a cure. We cannot get rid of that specific bacteria in the mouth, but we can prevent it from becoming active again, from becoming aggressive, and from recurring in the patient. So the first step in treating periodontal disease is what we call scaling and root planing. This is a deep cleaning procedure. It removes all the plaque, tartar from below the gum line and kind of smooths out the root surface to help prevent further buildup from occurring in those areas. Sometimes prescription antibiotics will be prescribed for the patient to help with the infection caused by the bacteria, but we'll also apply topical antibiotics. One product in particular is called Arestin, which is used pretty frequently in most dental offices for periodontal disease. Sometimes we'll send patients home with products to use as well. Prescription mouth rinses like Periomed contain ingredients like hydrogen peroxide and stannous fluoride, which are anti-gingivitis and anti-cavity. And then we see these patients more often for cleanings, 3 to 4 months instead of 6. Dental infections are treated through endodontic therapy. This is also known as a root canal. I'm sure everyone has heard of that before. The infected pulp tissue is removed. As you can see here, this is the pulp chamber, this dark line in the roots of the tooth. When a root canal is performed, this material is taken out of the tooth. It's replaced with a synthetic material that fills the cavity or the pulp chambers and nerve canals of the tooth. So this tooth is technically dead. There is no longer living tissue and nerve supply and blood supply in the tooth, but it holds the space and allows the person to be able to chew with that tooth. It's also treated through lancing, draining, and curettage, which is just draining the dental infection, taking a metal dental instrument, and kind of debriding that area of infected tissue. Tooth loss can be treated by using dentures, partial dentures, implants, and crown bridges. Here is a partial denture. It's usually a metal wire or a metal base with a resin material and resin teeth that are placed there. They fill the spaces of areas where people are missing a few teeth at a time. If someone is missing an entire arch of teeth, or they have teeth that need to be extracted that cannot be saved, the best option may be a full denture, which covers the entire arch. A dental implant is a screw that's placed into the gum tissue, and then a crown, like a single tooth, is placed on top. And a crown bridge is something that is permanent, does not come in and out, but it fills one space of a missing tooth there. Anatomical changes. These, like we talked about before, that are caused by cocaine, having a hole in the hard palate or soft palate of the mouth. We can treat these in a few different ways, most commonly by doing a bone graft. They may take bone from another area of the mouth if it's a smaller hole and kind of patch that area and allow the tissue to grow back together. Sometimes they use a synthetic bone material like bovine or a lab-grown material. And then there's also something called an obturator. This appliance here is an obturator. You can't see it very well, but it hooks onto the teeth. This middle part is covered with like a clear resin material, and it seals that hole so that when a person is chewing, breathing, sleeping, whatever they may be doing, food and things are not getting into that hole and going into the nasal cavity. So, resources for providers for education. When it comes to substance abuse prevention, there are organizations like Prevention and Technology Transfer Center Network. These play an important role in improving the effectiveness of prevention efforts. So, healthcare providers can go to this website here and find resources to find resources for training materials for their employees in their offices. They have technical assistance and learning resources available to professionals for training. Another important resource is the Center for Substance Abuse Prevention, which is a subsidy of SAMHSA. It is the Substance Abuse Network. It provides leadership in the development of policies, programs, and services to prevent the onset of substance abuse. They offer guidance and leadership in the development of effective preventive strategies. It helps to reduce the prevalence of substance abuse in communities. This is also a really good website for healthcare providers to go to find information for their employees to be able to help their patients that are going through substance use disorder. And then resources for patients. When a patient is seeking help for substance abuse, there are other vital resources that they can go to. The American Society of Addiction Medicine offers a physician locator service. So a patient can go to this website, click on their physician locator service, and connect to an individual that may specialize in addiction medicine. Including those who provide treatments like naltrexone and buprenorphine. These are drugs that help with battling addiction. The U.S. Department of Health and Human Services offers additional resources through their Find Treatment platform, where individuals can find a treatment provider or facility that suits their needs best. It can help them find appropriate care, whether it's inpatient or outpatient services. They have valuable information about the cost of treatment, as well as financial assistance and education on addiction and mental health. The Substance Abuse and Mental Health Services Administration, the SAMHSA that we discussed for the providers in the last slide, has an opioid treatment program directory where they can, again, go and find treatment centers that provide specialized care for opioid users. And then there's also lots of education about substance abuse disorder and how to find help. So, at the conclusion of this presentation, we are going to participate in a kind of an activity to help understand the provider and patient relationship and how the discussion should take place for helping these patients. So we'll split up into teams of two. One person will be the patient and one will be the provider. Each team member will take turns role-playing as a patient with substance abuse disorder, while the other will act as the healthcare provider, identifying the signs and symptoms of substance abuse in their patient. So the patient will answer a medical and dental history and discuss their health after an oral exam, and then the provider will identify the signs and symptoms of their substance abuse disorder and give the patient resources for treatment. So in the scenario that we'll use for this activity, the patient will be a 40-year-old patient who has been using prescription painkillers for chronic pain. You have noticed that your mouth feels dry and your teeth have become discolored. You're embarrassed and unsure if this is related to your medication use. And then when we are finished with this activity, we will also take a short 5-question quiz that correlates to each topic discussed in the presentation, and then answers will be reviewed at completion as a group. So I thank you all for being here today, to being attentive and participating in the activities and the icebreaker and the warm-up. I was happy to be here today to share this information with you, and I hope that at the end of this presentation, the goal that we discussed in the beginning has now been made clear to all of you here in the audience. So again, my name is Kayla Mosley. I'm a registered dental hygienist who is now working for the American Dental Hygienists Association. If you have any questions, please feel free to contact me or stay after here after the presentation, and we will review. Thank you so much.